Welcome, everybody, back to another episode of the Brass Tacks Business Podcast. Today, I'm thrilled to have Dr. Chad Woolner on the podcast. Thanks, Doc, for coming on. We really appreciate it.
You bet.
Shout out to Dr. J, who had a summit in D.C., and Dr. Woolner was one of the speakers there. So just a little bit of info about Dr. Woolner. He is the guest on today's show who's redefining what it means to truly help patients heal. Dr. Chad Woolner is a chiropractor, educator, and pioneer in the functional medicine and neurology field. He's the founder of Align Integrated Medical in Idaho, where he and his team specialize in non-surgical solutions for chronic pain and metabolic health issues, where they are helping thousands of patients get real results without relying on drugs and surgery. Dr. Woolner also teaches doctors across the country how to use cutting-edge therapies like low-level laser through his work with Orconia. And he's the co-founder of both Simplified Functional Medicine and Applied Functional Neurology, which are two groundbreaking training programs that are changing the future of healthcare. So I'm super excited to talk about both of those programs that you've got, Dr. Woolner. But first, I would just love to kind of learn more about you. How'd you get into chiropractic and kind of where you are today? Did you grow up in Idaho originally?
No, I didn't. And first off, yeah, thanks for having me on. Appreciate it. Honored to be here. I was born in San Bernardino, California. 10 years old, we moved to the suburbs of Portland, Oregon. So I kind of count Portland and or the surrounding cities and areas. That was kind of home for me. Grew up there and got married without any sort of education under my belt. My wife wanted to know what I was going to make of my life and my future. The career path went as follows. Originally was going to be a teacher. I come from a family of amazing teachers. My oldest brother is a Spanish teacher. His son followed in his footsteps as a Spanish teacher, actually at his same high school that they teach at together, which is kind of cool. So I went from teacher to then I had a really great friend and mentor of mine who was a dentist. And that kind of intrigued me, what he was doing. He seemed to really enjoy what he did, had a very successful practice. So I did some shadowing. And so then that was the game plan, was I was going to be a dentist. And so I went through and was doing all of my undergrad training, was about ready to take the DAT exam when my wife and I one evening were out on a date and we were rear-ended in a car accident. She sustained some pretty significant whiplash injuries. And we did what most people do, and that was we took her to urgent care and didn't really know what else to do. And it was upon recommendation of a friend of ours that we take her to a chiropractor. And so we did so, and the experience that we had was just incredible. It was an amazing experience. I got to watch this chiropractor with his bare hands like help fix my wife's issues, and that was like astounding to me to see that whole process. And so I started going with her to her appointments and started really kind of entertaining in my mind, like, is this something I could see myself doing? Is this kind of maybe what I'm better suited towards? And so one thing led to another. We went and toured. We didn't realize it at the time, but University of Western States was just down the road from us. It's about a 20-minute drive. And so we went and toured the school and was just so impressed with what I saw there. And so I was like, yep, this is what I want to do. Talked to my wife about it. She's like, if this is what you want to do, let's do it. So that's what took me down that road, and ultimately what became where we are. I mean, I guess fast forward now, been doing this since 2008. So yeah, been at it a while.
Wow. So I always like to talk to docs that don't have a very tenured background in chiropractic, as far as, you know, you've been in practice a long time, but I didn't come from a chiropractic background either. I feel like I have a lot of friends and colleagues across the country where their mom was a chiropractor, their dad, or they've got chiropractic in the family. So what was that like, you know, totally shifting gears, going, you know, thinking dentistry was what you were going to do, and then just kind of switching gears into chiropractic? Was it just like a big leap of faith, or are you pretty confident like this is way more interesting? Or what was it about chiropractic that helped you kind of change your mind from kind of the dental route you were on?
You know, that's a great question, a very interesting question, because I come from a family. My father is a retired registered nurse, was a nurse so I came from a very medically based medical background. One story in particular that I'll never forget, looking back at it now to kind of illustrate it, is I remember as a teenager having chronic headaches for a period of time. There was a period for like almost a year where I just had these unexplained chronic headaches. I would just get these headaches all the time. I didn't know what was going on. And so my parents, again, like not knowing what to do, took me to our primary care doctor. And I remember him like taking x-rays of my skull, like looking for like tumors. That was
Wow.
where his mind immediately went. And I thought that was so, looking back now, I thought that was so funny. I'm like, why in the world wouldn't you? And again, it's just because my parents didn't know any better. I'm like,
Yeah.
have headaches, take them to the chiropractor. Looking back now, I'm like, it's really simple. I was in
Hmm.
school. I was hunched over looking at, like what most high school students are doing, head forward, looking down at books, reading all day long. And so it's like pretty simple, straightforward. But to answer your question, so the interesting thing too is that University of Western States, it's probably no mystery to people that it's a very medically based chiropractic curriculum and program. And I remember that resonating with me at the time, like feeling like, and I felt and thought at the time that the dichotomy of chiropractic, we'll call it that kind of spectrum, on one end, more principle based or straight quote unquote chiropractors, and on the other end, more evidence based or mixers or whatever you want to call them. At the time, I felt like that resonated more with me because, number one, I hadn't had any exposure to real true kind of chiropractic philosophy. And number two, just because that's all I knew at the time. And so I remember that very much resonating with me. It wasn't until I got out of school and kind of went through several years of this, what I call kind of chiropractic identity crisis. And I don't know if other chiropractors can relate to this or not, but I remember finishing school at Western States and them really, kind of pounding into us this idea that, you are a primary care physician, that you're going to be seeing people. And while I most definitely appreciate that and appreciate the training that I received, while we technically, yes, do fit that bill of being portal of entry or primary care physicians, that's not, number one, how the public perceives us. Number two, that's certainly not how our medical counterparts perceive us at all. And so I remember feeling very like odd in the sense that, wait a minute, I thought it was going to be different. I thought they were going to view me as like a colleague, And then I also remember feeling like, well, I don't really relate either to kind of more of the philosophical kind of straight chiropractic camp either. And so I'm like, okay, if I'm not that and I'm not that, then what am I? I've got like some training in some, I'm kind of like a physical therapist, but really not a physical therapist. I'm kind of like a chiropractor, but not a chiropractor. What, kind of like a doctor, not a doctor. What am I, And I remember that really, there were several years, honestly, it didn't happen overnight. It didn't get solved or resolved overnight. I remember several years kind of pondering and wondering over that. And it wasn't until, to be honest with you, I started like working with other chiropractors across the country and having a greater level of exposure to like real true chiropractic philosophy that I started to really appreciate and embrace chiropractic philosophy, for what it is. And I think it sometimes gets mislabeled and or misrepresented at times, that I think the vastly or significantly oversimplified explanation of this kind of spectrum is, on one end, you have these chiropractors who think that chiropractic can fix anything and everything. And on the other end, you've got these pill pusher chiropractors who want to prescribe and all that stuff. And I think that's like and I think most chiropractors realize, like so many other things in life, politics, religion, whatever you want to call it, the two polar ends don't really represent the majority who are somewhere in that middle area. And so to answer kind of long-winded that question that you answered, I think it was through that kind of exposure to both ends of the spectrum, really truly get that real exposure to it, that I started to appreciate much better what I believe true kind of chiropractic philosophy is. And so I definitely resonate more with kind of that original true chiropractic philosophy. And that's not to say that Western medicine doesn't have its place, or that prescription medications don't sometimes have a place and aren't needed at times and things like that. But I just feel like in general, chiropractic in its kind of purest form really does amazing things to help, and is a really invaluable piece of the overall puzzle of the delivery of healthcare here in our country. So anyways, I don't know if that made sense or not.
Absolutely. No. You said your wife was very supportive when you did decide to go, on to chiropractic school. How about your parents? You said your dad kind of had more of a medical background. Were they also supportive or even interested, or were they familiar with chiropractic?
Yeah, my parents were supportive. They had minimal exposure to chiropractic. Supportive, but just didn't really know much about it.
Yeah.
That was really it. But yeah, very, very supportive, have always been.
Okay. Great.
Yeah.
Um, and then, so after school, kind of what was the transition? Did you open up your own practice right then, or did you go work for someone for a while, or?
Yeah, I was an associate for about a year, and then from there started what was at the time Align Chiropractic. That was in 2009, and first 4 years were miserable, absolute hell, sucked, didn't know what I was doing, and learned from the proverbial school of hard knocks. Definitely learned a lot of what not to do. And it was right around that time where I was kind of like facing a multitude of uncertainties in terms of what do I do. I had contemplated the idea of filing bankruptcy. Like, do we just throw in the towel altogether? Is this done? I remember at one point in time, we had looked at some opportunities down in Texas, as working as like an associate. And so I was contemplating that. And it was finally one day when I realized, I need, number one, I don't want to move. Idaho was our home. I loved where we lived. Number two, I needed some real mentorship. And so I reached out to a local friend of mine who was a successful chiropractor here in Idaho. And we had a really great conversation. He really was very kind enough to take me kind of under his wing and really do some coaching with me and help me kind of get my headspace straight. Had another friend of mine who helped me kind of clarify some things. And it was also right around the same time that a friend, Russell Brunson, he was getting ready to launch his now software ClickFunnels. Mm-hmm. And he had been kind of watching me struggle through this whole thing and was helping along the way to the degree that he could. And he at the time said, hey, I've got this software that's coming out. This might be helpful for you in terms of getting new patients. Do you want to be like a beta tester for it? And I was like, sure. And didn't really think much of it and started kind of playing around with it. Some ideas kind of came to mind and kind of the planets aligned, so to speak, and launched that. And that really transformed our new patient acquisition. We started, we were, as best that I can recall, I want to say we were probably maybe averaging 10, 15 new patients a month prior. And then all of a sudden we went to consistently every month 30 to 40 new patients. And then you couple that with the fact that my friend who was a successful chiropractor really helped mentor me as to how to really properly educate and communicate chiropractic to patients such that you can actually convert them into care. And so we did that and I was off to the races. And so all of a sudden it was like things changed in a massive way. And so then not long after that, probably less than a year after that, when things really shifted for me, a good friend of mine here locally was kind of in the same shoes I was in. He was struggling, brand new doc. He had been out for like a year or two and was just getting bad advice. And so I pulled him aside and I said, let's grab lunch. He's like, cool. We sat down and I just was very direct with him. I said, this is exactly what I did. This is what you need to do. He started literally doing to the T exactly what I was doing and completely transformed his practice. He's now got one of the best, busiest practices here in the Valley. He's doing well over $1 million a year, doing fantastic today. He's an amazing doc. And so that was kind of what catapulted me into kind of coaching and consulting and teaching and training docs on marketing and funnels. And then that was kind of how I became known in the profession as like the funnel guy, the chiro funnel guy. And so I had my course and I was teaching and training docs and all that. And that was kind of like how my entry into working with docs all across the country.
What a blessing to have Russell Brunson as a close friend back.
Yeah.
I'm guessing, was this before he kind of blew up with the ClickFunnels? He was basically teaching you how to do it before his program was fully exploded to what it is now.
Yeah, Russell's been known. So the interesting thing is Russell's been pretty well known in the internet marketing space for a long time. Like Russell kind of made his way into the kind of his original business, .com Secrets, which I think is still around, .com Secrets. He was early 2000s teaching people how to make money online, became very well known in the kind of internet marketing space. But that was a relatively small little pond, so to speak. Like he was well known amongst all like the internet marketing OGs, people like Frank Kern and Mike Filsame and who were some of the Ryan Dice. So a bunch of the kind of old school internet marketing folks, he was kind of well known, but not like he is today, not like he's known today. And so, yeah, it just so happened that, we were living in Boise at the time. We were there for about a year and then we moved into a new home and our first day at church. And I had seen Russell Brunson online. I had been doing some research for the clinic that I was working for. They were building a website, and they had kind of tasked me. They said, hey, can you help us building this website, or at least research? And I came across this guy, Russell Brunson, and then I had a friend of mine who's like, oh yeah, that Russell Brunson guy, he lives here in Boise. He's like this internet marketing guru and all that stuff. And I was like, oh, that's cool. And so then our first day in church, in walks Russell Brunson. I was like, we go to the same church. That's kind of crazy. So I introduced myself, and we became very fast friends, close friends. He's got kids the same age as my kids. And so he's got 2 twin boys that are buddies with my son, Sam, and they grew up together. And then he's got a daughter that's close to my daughter's age, and then a son that's close to my youngest daughter's age. And so we hung out with them, pretty regularly. Would do 4th of July with them and stuff. And so he was always like a spectator in terms of, and a fan, and always cheering me on, wanting to see how I was doing what I was doing in practice, both, kind of from a clinical standpoint, but obviously from a marketing standpoint, wanting to see what we were doing. And was always giving kind of advice on things and kind of helping. And it was kind of fun. And it's kind of been obviously crazy to see how things have evolved for him with his business. And, obviously things just blew up in a massive way with ClickFunnels. So it's been kind of fun to see that for sure.
That's awesome. That's awesome. So you opened in 2009. That you're having, would you say most of your struggles, and you said, those first 4 years were pretty tough. Was that just getting new patients in the door, or patient retention? Was it more like the business side of things, or more the clinical side of things? You feel like you struggled the most those first, few years, that it was pretty tough until you kind of got under a mentorship and started kind of changing things around?
Yeah. Looking back now, to be totally honest, it was a little bit of everything. I wish that I could say, oh, it's just this one thing. I think it was a lot of things. You just don't know what you don't know, New patients, getting new patients, I didn't know how to do that. I didn't know how to educate or retain patients or convert them into these sort of meaningful care plans. From a clinical standpoint, I knew how to adjust people. I was pretty good at adjusting, but I didn't know how to actually manage patients, in that process, and how to navigate those challenges and things like that. So kind of all of that together. The best advice that I could give for young docs is, and the things are, I think, vastly different today in our day and age. I remember it seems weird to think about it because it doesn't seem that long ago, but at the same token, I remember in '08 looking for resources and not really seeing a whole lot. I remember buying some random book on Amazon about how to start a chiropractic business. That's all I could find. But there were no podcasts.
Yeah.
There were no there was a couple old school coaching groups. I had hired one. I'm not going to name them, but they were awful. They were absolutely horrible. And so now you've got so many different resources today, so many different amazing mentorship programs and coaching groups out there. And that would be the best advice that I could give any young doc is do your homework, do your research, find a good coaching group, a good mentor, and hire them, pay them whatever you need to pay them to get them. And accelerate that learning curve dramatically, compress that time frame. Because when you can, there are right ways to do things and there are wrong ways to do things. And you've got really in essence 2 choices. You can go it on your own and try and figure it out, and that's going to take a significant amount of time, kind of like I did. Would not recommend that. Or what you can do is find a group or a mentor that are already using proven models and systems and just plug those right in. And that's the best advice that I could give. Because otherwise, the one thing I can say and say as loud as I can, as long as I can, is time is infinitely more valuable than money. Yeah. And so don't too often I find docs they're tripping over dollars to pick up pennies, meaning I don't want to pay this person because it's too much. And so therefore what I'm going to do is I'm going to spend the next year researching and investigating and basically just procrastinating and not pulling the trigger on anything. And at the end of the day, it's like, look, do your due diligence. There are plenty of ways of determining good groups out there. Like I said, there are several really, really good coaching groups out there today. So you're not for a lack of really good resources. And once you really have, and really it's just getting on social media and talking to groups, plugging into other docs and just asking, hey, what do you think of this group or that group? And or this mentor or that mentor, and you're going to find people are going to be very helpful as to pointing you in the right direction. And once you've kind of got that dialed in, don't hesitate, pull the trigger, go to work, plug in exactly what they've done, compress the time, and you're off to the races. That would be the best advice that I could give to docs.
It's so interesting. I had a similar experience when I was starting out. I had multiple other chiropractors that kind of, same kind of thing. I knew I was opening my own practice. I had no idea I didn't come from a business background. My parents weren't small business owners. We weren't entrepreneurs or anything like that. But I remember I had a couple different, one was a chiropractor and one was a dentist. So shout out to Dr. Noya and Dr. Klostro. Both of them were just pivotal in really just being so abundant with their time and their advice. And just like you said, Dr. Woolner, how you kind of had somebody take you under your wing and then you went and kind of mentored somebody else. Same exact thing that, I feel like happened to me. I was getting such great advice, and we did hire business coaches, and that was extremely valuable. It helped grow me and my wife's businesses tremendously. But then I feel like the most rewarding part is like just giving that information to others we just had another chiropractor literally open up in the next building, and he came over to my office and he felt that he wasn't getting the acceptance from some of the other, providers in the area. And I was like, you can come by anytime. I'd love to refer patients back and forth. You have your specialty, I have mine. Do you feel, and maybe in your area, or have you experienced, since you've been in practice for such a long time, a lot of competition amongst other providers, or do you find that that doesn't happen around you?
No, I've always felt here in Idaho in the Treasure Valley, it's such a small, it's getting a lot bigger, right? But it's always been, since I've been here, kind of perceived as a small community. And I think as such, we've got great providers here for the most part, but I think there's always been a little bit of a fear, a little bit of a scarcity mindset collectively amongst my fellow colleagues. That's just my perception. I don't think, and I think just because there's a massive saturation here, and so for me, I've personally never felt threatened, if you will. My friend, like I said, that I helped and mentored, he's literally just a couple miles down the road from me, so not far at all. So he is quote unquote a competitor. But I'm always sharing with him literally exactly what I'm doing. I don't care. His practice is not completely different than mine, but different enough. He's more of a family prenatal pediatric type practice, although he sees a variety of other things too. But that's really his kind of primary focus, is where he's at, and so it's sufficiently different that I'm not ever concerned or worried. And at the end of the day, even if it was literally the exact same type of practice as mine, still wouldn't be worried. There's more than enough to go around, especially when you're focused on, there's and I hope this doesn't sound like harsh or arrogant, but there's a saying, that winners focus on winning, losers focus on winners. And I've always taken the approach of, I don't, and again, I don't hope this doesn't sound harsh either, but I don't think of competition. I think of my goal to make all of the various quote unquote competitors irrelevant. That's my whole point is and not in any sort of a harsh or rude or cruel way, but I'm constantly focusing on how do we make our clinic stand out and really decommoditize our presence in the community such that we stand out head and shoulders above everybody else, that our clinic is viewed and perceived vastly different, that we're not just like your typical clinic. And so we're constantly working on evolving our presence, our processes, our systems, everything that we do here, such that we stand out in a very, very real and a very good way. And so from a standpoint of competition, while I do think there is a lot of perceived competition here, I try not to think of it that way. That's just me.
Totally agree. And I think we're all unique in our own way. Even if we may treat the same type of client, or maybe even we do a similar modality or a treatment technique, someone's going to resonate with Dr. Woolner better than they're going to resonate with Dr. Brassfield, or vice versa, right? We all have our own unique, I feel like, personality and characteristics and things like that too. And that's what I think, like you said before, there's that fear of competition where when you have that abundance mindset, you realize there's plenty of patients for everybody, and I think that's one thing. I'm glad you brought up the practice, because Doc, you blend chiropractic, functional medicine, neurology in your treatment approach. How have you seen that kind of benefit your patients and get better outcomes for your patients?
Yeah, great question. I think the biggest thing that I would say is what it's done is it's opened the door a lot wider to be able to serve people to a much, you can either say higher level or deeper level. Either way, same sort of idea, right? Is that instead of our, we started off originally, as much as I don't want to necessarily admit it, we were just a pain clinic. We were a symptom-based, again, coming from Western states, the model, it was very much a relief care model. And that's no disrespect to that. If that's what you want to do, you can totally do that. But I grew tired over time seeing the same types of issues and being that kind of broken, tired record of like, doc, I'm here. Why does my back keep going out on me? Why do I keep having these issues over and over? And it's like, it's not a mystery. It's that you're not taking care of it, that we're not actually solving the underlying issue or issues that are causing these problems that you're having in the first place. And so I got to a point where I'm like, I really want to make sure that our focus for our patients and our community is that we're a place that solves problems, not just puts band-aids on symptoms. And so to answer your question, what that's done for us is that's really allowed for us to have a far more meaningful relationship with our patients and a deeper relationship from a standpoint of when patients come through here, our primary goal, or our primary first step, I should say in the first place, is to get clarity on what their real goals are. And most docs think that they know, but they don't, unless they really truly take the time and have the skills and know how to communicate properly and ask the right questions. You're never going to get that level of depth and meaning and real, honest insight on what the patient's real goals are unless you really truly have that conversation and ask. And so for us, to kind of answer that question, we start with finding out what a patient's real goals are. And so for most patients, it looks like they want to get back to playing with their kids or their grandkids. They want to travel more. They want to be more active. They want to get back to work. They want to do meaningful things. And so in order to help them reach those goals, the approach typically needs to be an integrated approach, right? Meaning not just one tool, technique, or modality or thing that we do, but rather a combination of those things. And that's really what has led us to integrate everything that we're talking about, chiropractic, soft tissue rehab, low-level laser therapy, functional medicine, functional neurology, all of those things. And so I don't know if that answers the question appropriately or correctly or whatnot, but that's kind of my thoughts on that.
Definitely. And I know functional medicine is a big topic right now. We get a lot of people asking about, can you tell us kind of what functional medicine means to you or maybe your philosophy and kind of how you've been able to implement that into your practice?
Yeah, great question. So functional medicine, my foray into that really began with my wife, who was dealing with chronic health issues for years. We had taken her from doctor to doctor, specialist to specialist, and just couldn't get any answers. And finally, out of just, quite frankly, sheer frustration, I went to school. I had been hearing about functional medicine. I had friends who had been to seminars and things like that. And I had had some little exposure. I'd read a couple books and been to a course here or there. But finally, I went through a training program and just kind of bit the bullet and said, this is what I'm going to do, if for no other reason, to learn how to get some answers for my wife. So to answer your question, what is functional medicine? That term has been so, I think, used and or overused at this point in time that I think it's lost a lot of its meaning. But Dr. Jeffrey Bland is the guy who first coined the term functional medicine. And the way that I understand him explaining it was, really, we're not just looking at symptoms and or disease diagnosis and or disease management, but really what we're looking at is we're going to look at labs in a different way. We're going to look at them through a functional lens as to how we can, functionally help the patient on a day-to-day basis. And then from there, what we're going to do is we're going to use a variety of different natural approaches to helping solve for those functional problems. And so that may be a very poor explanation or whatnot, but for us, the way we look at functional medicine is we look at it very similar to the chiropractic philosophy. Our explanation of what functional medicine is it is a means or a way naturally of helping patients tap into their body's own innate ability to heal itself. And so we're very big on that. We're very big on this kind of inside-out approach versus an outside-in approach. And that would be our biggest kind of frustration and contention with what functional medicine, to a large degree, conventional functional medicine approaches have really become this kind of outside-in approach. Meaning, if you go to many functional medicine practitioners today and you say, hey, I'm struggling with XYZ symptoms or problems, they're going to run a battery of different tests on you, and then from there they're going to find all these different markers, and then from all the markers they're fine, they're going to prescribe a litany of different supplements for you, hand over a big old box or garbage bag full of supplements for you. And that's, and then, they'll give you a PDF and tell you need to change your diet and you need to eat better and you need to get exercise and rest and all that fun stuff. Kind of like, okay, no real sincerity in terms of the delivery or no real intent on. Yeah, exactly. No real clear plan or ability to actually deliver the outcome, but rather here are all that. And at the end of the day, this is why if you're practicing functional medicine like that, this is why you should be very, very worried, because AI can do all of that and then some and do it better and faster. Literally today, a patient who's dealing with any sort of symptoms can go into ChatGPT and type in their symptoms. ChatGPT can list out exactly what labs they need to run, and for what reason. And then they go to the doctor, or not even go to the doctor. You can go to labs now that'll just, you can do it without a prescription or without any sort of doctor requisition form or order or anything. There's direct labs to patients now anymore these days. So you can get your own labs, have a phlebotomist come to your house or go to a blood draw center or whatever. You run your labs, you get your lab tests back. You don't know what any of them mean or say or anything. Again, you can upload those PDFs into ChatGPT and say, hey, can you interpret these through a functional medicine lens? And again, it's going to spit it out for you. Okay, based on everything there, what supplements should I be taking? What should my routine be? What should my diet be? And it'll spit out a whole plan for you today. And so if that's what functional medicine is to you and that's the way you're practicing functional medicine, you should be very deeply concerned, because your livelihood is in very real jeopardy. That's what's going to happen. And so for us, we argue our whole program, Simplified Functional Medicine, is so much more than just that, more than labs and supplements. We always ask the question, the litmus test. If your functional medicine program, the one simple question is, if we were to remove labs and supplements from your functional medicine program, what do you have left? And most practitioners who are practicing that kind of conventional way are going to say, not much. There's not much left there. With us, we teach and we train on lifestyle. We really do. We have morning and evening routines. We have dietary changes that we help in implementing. And when we say help in implementing, it's not really so much about the diet as we teach the psychology behind habit formation, right? Breaking bad habits and building new ones. And so a big part of our curriculum is taking them and truly coaching them and helping them understand kind of the scientific approach, the proven approach to how do we actually change the way we live and act and behave. And so it's a lot of things, it's a lot of strategies that we talk about that are proven that people know that they're just not doing, right? Moving more, stretching more, using tools like breath work and meditation, using tools like biofeedback, using tools like cold immersion and sauna sometimes if necessary, using, coaching and or connection with other people, designing your life. We call it environmental design, designing your environment that you're around, your relationships, right? All of these things play a role and bleed into either our health or our lack thereof. And so this is all stuff that we've kind of woven together into our program. And of course we have labs, and of course we have supplements. That plays a role. But if that's the main thing you're leading with there, or that's the primary thing, you're not going to help people. And so to us, what functional medicine really is it's a true root cause approach or root mechanism approach to helping people get better and then stay better long term, right? So that's the best definition I could give based on that. I know it was kind of a long-winded answer, but hopefully that's helpful.
And definitely, if you're just giving people a garbage bag full of supplements and a sheet with a list of things to do, if it was that easy, everyone would be doing it, right? So
exactly.
Dr. Woolner, when you're talking about changing habits, because I feel like that might be the most difficult part, right? With these lifestyle changes, with these recommendations that you're doing, what has been the most effective way that you've been able to, because you're right, you're getting people better, but then you want them to stay better. So to change that habit and maintain that habit over a long period of time, what have you found to be kind of just the most effective way to help patients that way?
It's going to sound overly simplistic, but it's just the truth, is your habits are a direct reflection of your identity. And so if you do not have a clear, empowering identity, if you're, again, the best way I could answer it is if you're not pleased with the habits you're doing, either you need to stop certain behaviors or you need to start certain behaviors, your life is a direct reflection of your identity, of who you truly believe you are. We live in such a way, like congruency is a really big thing for human beings. It's part of our kind of survival mechanism. And so if we're living incongruently, we're going to do whatever we can to create congruency, right? And so oftentimes, I would say the easiest way to create that congruency is either A, you can change the way you're operating, or easier is change the way you feel or believe or perceive who you are at your core, your identity, right? And so like if for instance with me, like I had my own health transformation journey. I've lost about 40 pounds. I was way overweight. I was pre-diabetic, and it wasn't until I did some really deep soul searching, if that's what you want to call it, identifying my identity. And my identity was I was kind of the chubby guy. I was the fat guy. I was just kind of this guy who loved food, and I was just kind of this, had the dad bod, and that was just it, and that was what I was just going to accept. And I was just like, okay, I'm kind of like, I'm not completely and utterly unhealthy, but I'm not super healthy either. I'm kind of down that kind of middle of the road. And I realized that identity was a very disempowering identity that was not helpful to me. And so I really had to do some kind of rewiring deep down inside as to who I truly wanted to be, what my identity needed to be. To really maintain a long-term habit, and so much so that I've rewired myself that I'm not going to be the fat guy anymore. I'm healthy. I'm going to be the guy who exercises. I'm fit. I exercise regularly. I take care of my body. I don't just eat for sheer pleasure. I eat intentionally to fuel myself the right way. And again, am I perfect at this? No, I'm certainly not perfect at it, but I am certainly better than I was 2 years ago. You know, like I said, if you see pictures of me, my business partners laugh at me because they look at my driver's license picture, and it's like, it's atrocious. I'm like, my face is like much, much bigger. So yeah, if you see pictures or videos of me from several years ago, you'll see, whoa, he had a much, much rounder face and a lot of like inflammation, and I had a big gut. And so to answer your question, the most long-term permanent way to change habits is to change your identity. Change your identity, you change your habits that reinforce your habits. And then what happens is it's this infinite loop, right? Your habits reinforce that identity, again, to create that congruency. And then the identity reinforces the habits. Same back and forth.
Some of the best coaching advice I ever got was, it's like the decisions you have made are a direct result of where you are at right now. It's no one else's fault. You know, I think a lot of people like to put it on somebody else or not take it accountable, but it's the absolute truth. You know, wherever you are in life is a direct result of your decisions. Now, whether those decisions were good or bad, probably, you know, has resulted in where you're at.
Yeah.
And I wanted to touch on your functional neurology as well. Do you blend that with the functional medicine, or is that kind of a separate program for people that come into your office?
Yeah, separate program. And so that's entirely for things like neurodegenerative issues, cognitive decline, traumatic brain injury type issues. Your most common kind of big brain problems today that people are struggling with. And the impetus for this program was, number one, brain health problems are just getting worse and worse. It's the epidemic of our day and age, and there aren't really a whole lot of viable real solutions that are available. And we got together with my team, Dr. Wells, Dr. Green, and Dr. Trevor Berry, and our belief and philosophy and approach is that our answer, if you will, to that problem is we have to mobilize a far greater number of practitioners to be empowered with the right systems and tools and training to be able to solve these issues. The problem with so many of the conventional approaches to functional neurology, as you can imagine, is this is a very complex topic. So how do you streamline that? How do you simplify it? And our answer is you don't simplify the neurology. What you simply do, though, is you arm practitioners with the right systems and tools and technology that is safe and yet very, very effective that they can start using immediately. And really our argument is you learn by doing, not by putting yourself in this academic vacuum and going through cases and studies and papers and academic textbooks for years and years and years, all the while never really implementing these things into the real world and thereby not really truly learning. You know, one of my favorite quotes by Stephen R. Covey is, "To know and not do is to not really know." And so for us, a big part of the impetus of what caused us to create applied functional neurology was we wanted practitioners to start applying sooner rather than later. And so that was one of the kind of beautiful things about this program that we've developed, is we can get practitioners up and running, armed with the right tools and the right systems very quickly without having to be a, board certified functional neurologist. And for those who do want that, by all means, you totally should go down that road and go to these, different deep dive training institutions, but start helping people sooner rather than later. Because the thing is that every year that you're not applying the right systems and the right tools and treatment technologies for patients is a year that they're getting worse. We just need practitioners to step up and start helping more. And so our philosophy is there are plenty of proven therapeutics that are out there that can be applied quickly and very, very safely, regardless of your level of training, right? That most chiropractors today have a sufficient background in training to be able to help provide solutions for these people, especially if they're the right ones, if they're stacked and combined and integrated the right way using the right systems, which is what we've developed with applied functional neurology, so that, again, my patients who come into our clinic for these brain problems, they know they're not coming to see Chad, the brainiac wizard neurologist, because I don't claim to be a neurologist. I don't make that statement at all. And yet here we are, we're doing quote unquote functional neurologist. And that might seem like an oxymoron, like, wait, you're not a neurologist, but yet you're doing functional neurology. Yeah, we're using, again, very valid, very safe, and very effective therapeutics combined through a system, right? And these are all things that no one can argue with. We're talking about using low-level laser therapy. We use zirconia lasers. Like, look at the research. You can't argue with that. We're using mild hyperbaric oxygen therapy. Again, you can't argue with that. We're using supplementation, and or you could call it functional medicine if you want to call it that, but we're using supplementation and dietary modification, as well as some simplified and streamlined basic neural rehab. And when we say basic neural rehab, it's not rocket science. It's getting patients moving, getting them metabolically active. And then we're using neurofeedback as well. And again, these are all things that when you combine them consistently over a period of time, you can really drive some pretty incredible outcomes. And we're proving it with the patients that we're seeing. It's pretty incredible.
Are you finding a lot of crossover between the neurology and the functional medicine, or is it just in regards to, like you were saying, some of the supplementation or the diet recommendations?
Yeah, you totally will. You're going to see, for instance, if it's affecting negatively the gut, it's affecting the brain for sure.
Right.
Affecting the brain, it's affecting the gut, vice versa, So your body isn't like these different systems and vacuums that are operating independently. So of course you're going to see crossover for sure. And so the program, but the difference being is that the functional medicine program that we've developed is really designed to go after things like digestive issues, hormone imbalances, depression, anxiety, weight loss resistance, metabolic dysfunction. And that's not to say that, the brain's not involved in those, and so therefore we're not going to touch it. But the whole idea would be start there, and then if we're still dealing with, say, some very clear neurodegenerative issues or a traumatic brain injury, then we can ascend the patient into a more neurology-based program, right? So really, at the end of the day, the short answer is we serve the patient based off of what their primary goals are and what their primary presenting problems are, right? So if they come in and their primary problem is, I was in a car accident and I hit my head and now I've got massive brain fog and memory issues and stuff like that, of course we're going to focus on the brain first, right? It might also so happen that they bash their elbow and they've got some, or not even that. I've also had this hip issue for years that's completely unrelated. Cool, let's get the brain thing under control first, then let's go on and let's move on and how can we serve? Or brain issue, and then also I've been wanting to lose weight. Okay, cool, then let's talk about it, whatever that is. And so there is crossover, if you will, in the sense that really we look at the patient and it's the journey, not the destination, as cliche as that is. We look at that as how do we help them along this journey.
And what would, like you said earlier, there's just not enough doctors doing functional medicine, functional neurology, and obviously doing it in the right way.
Sure.
Do you think it's just like overwhelming for people to be able, like you said, you can't just sit in academia for years and years and years and expect to be able to help people? Is a lot of it just like you recommended, the implementation, or what would be your advice to try to get more doctors to be able to help more patients to get great results?
Great question. And you're exactly right. Nail on the head. Having talked with literally hundreds, if not thousands of practitioners over the years, many of which already have extensive training, more training than I do, in terms of functional medicine, functional neurology. And yet they're stuck in this kind of analysis paralysis, like how do I even begin to implement? And so for us, that is what you just highlighted there is the preeminent problem, if you will, both with functional medicine and functional neurology, is you have so many doctors. It's not a lack of training or education or know-how or knowledge in terms of the biochemical pathways or various nerve pathways or brain pathways or whatever that is. It's none of that stuff. It's the how do I take all of that, synthesize that, put that into protocols and systems, and how do I deliver that, and then how do we get paid for that? How do I create the financial model behind that and business model behind that? And that's all stuff that's its own beast in and of itself.
Well, that's what I was going to ask you next is obviously, we want to help patients, but we also have to, keep the lights on. So Did you find that was a very difficult aspect of your two different programs is like, okay, I've got, the protocols and everything, but now how do I implement it into my practice so that it, we've only got so many hours in the day and we want to be able to provide value, for our patients and we want to get them great results. How did you kind of navigate the business aspect of that and implementing it into your practice?
Yeah, we could talk about that for hours. But the long story short is that we developed systems. We developed systems that allow us to streamline that process. Really, at the end of the day, patients are not just going to walk into your office and say, Dr. Keith, I'm struggling with, hormone imbalances or gut issues or, brain fog or whatever. Tell me what you've got. And you're like, well, we have this program. It's $5,000. And they're like, okay, I'll pay you $5,000 for that program to solve it. It's like, that would be awesome. That would be ideal. But people don't do that, right? And the primary reason why is because people make value decisions based off of proper education and context. Right? So the cliche, silly, stupid, whatever you want to call it, analogy is that if I held my hand up to you like this and I said, okay, I've got something in my hand here and I'm going to sell it to you for $5,000. No one in their right mind would pay me $5,000 for the thing that I have in my hand, right? Or whatever. I'll actually put something physically in my hand. It's AirPods, right? You just paid $5,000 for a pair of AirPods. Like everybody's like, that was a stupid decision. All of a sudden, let's say I had a key to a brand new Ferrari and you paid $5,000. You're like, score, right? But the reason why they're not going to pay that, and everybody's like, well, I don't know what's in your hand. And that's true, but it's a lack of context. If you don't have context, you can't make a values-based decision. And so what happens is people, that if you say, hey, I have a brain program and it's $6,000, it's $7,000 to help you with your XYZ brain problem, right? They're still lacking a tremendous amount of context because number one, first glaring question is, can you really help? Number two, okay, if you can, how long is it going to take? What's involved in the process? Is it risky? Are there, weird things that you're going to have me do? All those questions that are, and then plenty more as well, dozens more. And so you have to have a system in place to be able to efficiently educate them in that process so that you provide that proper context so that we understand and answer a couple questions. First question, obviously, ethically, is can you actually help that person? And we can't always guarantee anything, right? But is there a reasonable level of hope and or expectation that can be there, right? If a person, as chiropractors, we've been doing this long enough, most of us, even a brand new doc, someone off the street comes in and says, my low back is killing me, and you do an evaluation and you find, okay, this looks like it's a disc issue. Yeah, there's a very reasonable certainty that I can help this person. While not guaranteeing it, the likelihood versus this is a back issue. And let's say you do an evaluation, you come to find that there's something very serious, like an abdominal aortic aneurysm. You're shooting that person over a cauda equina. You're sending that person to the ER, And so from an ethical standpoint, the first question that we have to assess and address is, can we even help that person? Or does it seem reasonable or likely that we can help that person? Then from there, obviously, what are their goals? We got to get clarity on their goals. And then from there, we have to look at the nature of what's really going on. And then from there, we then go through the process of educating them as to what's really driving the issues, what's really the root issues. And the thing is, the nice part about, I don't care if you're talking about a brain issue, a gut issue, a knee issue, chronic issues altogether, they're the same root issues, right? Barring the rare, mysterious kind of genetic things that Dr. House, MD, is going to solve on his TV show, the mysterious, like, great. There are wonderful doctors out there who that's their area of specialty. We're going to dig in. We're looking at weird genetic anomalies and stuff. The vast majority, when you look at the science today, the vast majority of today's biggest brain health issues, we'll say neurodegenerative conditions, it's no mystery as to what's driving those things. It's chronic inflammation, it's gut dysbiosis, it's lifestyle-induced stuff over time, and so we call it stress, right? Physical stress, chemical stress, emotional, or as chiropractors put it, the 3 T's: thoughts, traumas, toxins, right? That's what's driving these issues. When we really clear out all the fog and really go sufficiently upstream, we look like that's what's driving these issues. So if we can really put together a meaningful plan of attack and educate the patient on how we're going to do that, that's what sells the value, because now all of a sudden they see a much greater level of clarity on what that outcome is going to look like, the perceived likelihood to achieving that outcome. And then if you have a sufficient system in place, what that's going to do for that patient is that's going to instill confidence in them that you're going to help compress the time frame so that they're not going to have to go search for all these things themselves and go on this kind of long-winded journey that may or may not result in a successful outcome. And then if you're doing a lot of these things and you've put all these things together, it dramatically reduces the amount of effort they have to put in. They're going to have to put in some effort, but with you coaching and helping and assisting and using the right tools and the right systems, it reduces the amount of that effort. And so now all of a sudden what you have is, if you've ever read Alex Hormozi's book, $100 Million Offers, he talks about the value equation, right? What people value, I don't care what the problem is that we're solving for. It's a simple equation. The top line is the ideal outcome multiplied by, or plus, whatever you want to call it, the perceived likelihood to achievement. We're trying to increase that. And then the bottom line is the time to achievement of that, plus the exertion, the effort and the exertion that's the perceived effort, right? So we're trying to reduce that. We're trying to compress time, make it as quick as possible, as humanly possible. That's not saying we're going to solve brain problems overnight, of course. We're going to be ethical and honest about this whole process. But as much as we can do to increase the top and decrease the bottom, that's where people all of a sudden start to create belief and thereby value. Okay, I'll invest $7,000 in that solution because I actually do believe that this person can help me, that there is a high likelihood and a high probability, a high certainty of a solution that's there for me.
With you having now over 15 years in practice, you've obviously been able to help thousands of patients with these different programs, and now you're obviously teaching other doctors how to do this, right? You're teaching them how to implement this into their practice. What do you feel, Dr. Woolner, has been the most rewarding part for you over your 15 plus years doing this?
Great question. I love people. I've come to just learn that, whether it's a patient or practitioner. I have a really soft spot in my heart for practitioners, just because I've heard the saying before, your passion comes from your pain, or your greatest passion comes from your greatest pain, or something like that. I don't know where I heard that or whatever, but for me, I think I'm most passionate about helping practitioners because I just know very intimately well the day-to-day struggles and challenges and frustrations that we deal with. And so if I can be some sort of a help in that process of helping to solve problems for practitioners, common problems, big problems, I find that incredibly rewarding. And whether I get paid for it directly or indirectly or not, for me, this is not just about the money, although money is great. I love getting paid and I love making lots of money. That's fantastic. I'm not shying away from that. But for me, I want to make sure that the things that I do that pay me are also incredibly fulfilling. And so I find it, in terms of answering your question of what's rewarding, just helping solve problems for people. Feeling as though the work you do matters, feeling as though what you're doing is of use and of value and of help to people in very real ways, trying to serve people honestly and sincerely to the best of my abilities. That's what gives me meaning in the work that I do. That's what allows me to feel like I can go home to my family and be the best version for them, look myself in the mirror and know that I'm doing right by people. That's what's fulfilling to me. And in that whole process too, the other thing that's very rewarding and fulfilling for me is creating cool stuff. I love working on business from the standpoint of I'm a creator by heart and by nature. I'm a musician. I've played guitar since I was a kid and recorded music and done all the artistic stuff. I've always been kind of artistically inclined. Not sure I'm, being good at it or great at it is a different thing altogether, but I enjoy that. It's very fulfilling for me. And in a similar way, I love to create things. And so for me, so much of this process, if I can create really cool stuff, create cool solutions, create cool programs and or approaches for practitioners and for patients, that's fulfilling. I love tinkering with and creating. I love creating good content that educates patients and lands well with them as well as practitioners. So the creative and creation process is also something I find incredibly and immensely fulfilling.
Wonderful. I agree. I think there's so much to say about, the difficulties and the trials and tribulations that we go through, because like you said, it's all about the journey, not the destination. And I've only we started our practice in 2019. So we just, 5-6 years old now. So not the lengthy career you've had, but that's what I've felt like, even, going through COVID and all those things. And as hard as it was, there's no way I would be where I am today had I not been through all those difficulties, because it really does make it rewarding.
For sure.
What do you feel, if you had one piece of advice to give to your younger self back in 2009, or even some of these young docs, like you mentioned earlier, that are getting out of school, they might be an associate for a couple of years and they're looking to, branch out on their own and start their own office or practice, what would be one piece of advice you'd give to them with all your experience?
Study Stoicism. I love all of Ryan Holiday's books. The one that has made a massive impact on me over the years is The Obstacle is the Way. The old Stoic saying, "This too shall pass," I think is such a profound, insightful statement, both in the bad times and the good times, right? If you look at really, at the end of the day, what Stoicism is really, truly all about, it's all about not getting worked up over the past or the future, right? Focusing on the present moment, that which you can control, and really leaning into the present, and that, and understanding too that with that this too shall pass. Again, whether it's like, we just celebrated my daughter's 15th birthday the other night. We went to sushi with her, and I look back at the 15 years, and they've gone by very, very quickly, as the old cliche, sounding parent. Oh man, it's a blink of an eye. It goes by. It really does. It goes by so quickly. And so just understanding and recognizing, even in those joyful moments, here we're celebrating her birthday, just knowing like this will pass. It's going to go by really, really quickly. You're living on top of the world at your highest of highs, that's going to pass. But also on the flip side, when you're in your, really difficult times, just know when you zoom out, it's going to pass. You'll get through it, and I love, one of the things that I love about Alex Hormozi's stuff is he said this time and time again, that business, what he's come to find, and I'll put a lot of stock in what he says, having built a, close to at this point $1 billion portfolio of businesses that he runs. Success in business has far more to do with just weathering the storms and kind of a war of attrition, if you will, just kind of being able to endure, than it does like talent or skill or luck or anything like that. If you can just endure difficult times and weather those storms, and again, that goes back to the whole "this too shall pass" type approach, that Stoic philosophy, I think that's the best advice I could give.
I agree. So many people give up too early, and
All
it's
the
just
time.
like, if you can just endure and just keep on, just persistence and persistence and persistence. Well, what's next for you, Dr. Woolner? Do you have any big projects coming up that you're currently working on, or anything we can tell our listeners to kind of tune in the near future for you?
I'll be speaking at the October Ohio Chiropractic State, OSCA, Ohio State Chiropractic Association's annual convention in October. I think that's the first weekend in October. Sooner than that, though, I'll be speaking at the Erconia Laser MBA seminar. This is the Marketing and Business Accelerator. So if you have low-level lasers and you want to learn how to use those, not just clinically but from a business standpoint, so that they can generate a significant return on investment for you. You want to learn how to get more new patients through the door, whether you have lasers or not. If you just want to, hey, I wonder about those lasers or whatnot, that's what the Laser MBA is. We're going to be showing you exactly how we have weaved lasers into everything we do at our clinic, how we use these to not only generate better patient outcomes, but generate a lot more revenue as a result. And so that's going to be in August 8th and 9th down in Phoenix. And those are the two biggest things on my radar right now that we've got going on.
Awesome. If any, say there's any other doctors or providers that are listening, they're interested in functional medicine, how can they get signed up with your program or reach out to you to find more about, your coaching programs that you have for the functional medicine or neurology?
Yeah, Simplified Functional Medicine is www.simplifiedfunctionalmedicine.com. Applied Functional Neurology is www.afneuro.com.
Awesome. Well, thank you so much again, Dr. Woolner, for being on,
You bet.
and we really appreciate it.
Thanks, man.
Have a great one.
You too.